Good afternoon. Please note that this session is being recorded. If you do not consent to being recorded, you are asked to drop off the session at this time. Thank you. I know we're not going to have anyone drop off. So let's move forward. Thank you all for continuing to stay with us. The Surgeon General did an awesome job starting the conversation that we're going to go into more detail about. So it should be really exciting. So my name is Adriana Marzette, and I am a public health program coordinator with the National Indian Health Board. I will be moderating today's session of Don't Miss Your Shot COVID-19 Youth Summit. This is the where and how to find accurate COVID-19 information online session. And we have the fabulous Allison Waukau here with us as our presenter. Before we get started today, I just want to go through a few housekeeping notes. Today's session is being recorded and it will be available for viewing on NIHB's YouTube channel and the website in a couple of business days. So check at the end of next week. I have also enabled live transcript for the meeting today, as we have found it can be beneficial for some attendees. If you wish to hide the live transcript, you may click on the live transcript button and then hide subtitle. All participants have been muted. Please leave yourself on mute unless the presenter specifically asks you to unmute and engage. If you have any questions for the presenter, please use the chat feature in the Zoom box. Both myself, Darby, and Courtney will be moderating the chat to make sure that no one questions or comments are not, recognized. We will hold most questions until the end of the session. And at that time, either I or Darby or Allison will address all questions during the Q&A at that time. If you have technical issues, Zoom start acting a little iffy, please reach out directly to Courtney or Darby. The presenter's PowerPoint presentation will be available for all attendees following today's session on NIHB's website. Thank you for your participation, and I will now turn it over to our presenter, Allison, who now has the floor. Thank you.
Hi, everyone. I'm really excited about being here. Usually I'm in library things, and so it's really nice to kind of step out of the box. So Allison Waukau, I'm Menominee and Navajo. My clans are Tatanazani and Owasso, and my parents I always like to acknowledge them, and so Lawrence Waukau and Mary Alice Sosi. And I work out of Hennepin County Library here in the Twin Cities in Minnesota. And I believe we're from all over, right? So it's really nice to see you all and be here. And I appreciate being asked to present today. So the first, if we could, the first slide that I have for you all is like how to weed out bad sources. I tried to make this, I was actually had a lot of fun making this presentation. And so weeding out bad sources. So the first thing that I would say to you is who is the author? So when you, and this is, I will get more COVID specific towards the end of the presentation, but this goes like across the board in any research that you may be doing, right? So one example that I like to give is when there was some promotion years ago that it was really good to have a glass of wine every evening, right? And this may be before your time, but and I'm sure the study is still going around. And the more we looked into it, it was the research was funded by different alcohol companies, right? So this is just it was for their own good, right? So you really need to look at who is the author of this study, this research, this article, because where is the money coming from? Who funded it? So if the author is a doctor, yes, but who may have paid him for this article, right? So just ask yourself, who is the author here? And then the next one would be, what platform are you on? So this is really an important thing to inspect. If you are using social media, they do give you more of what you already have clicked on, right? We all know this. Like if you're on TikTok looking up like dog videos, you're just going to get more dog videos, right? So I really have become a fan. I'm not sure if people have heard of this yet, but of DuckDuckGo. It's a search engine that does not save your searches. It's really helpful in researching. So if you have a random question that you want to put out there, but you don't want, your ads to start coming, right? So using a search engine like that is a really great tip. And then also knowing when you comment or share on a specific photo or video, you have saved data. So you're going to start getting more bots to target you. And bots are something that are fake. They are computer generated, and they're fake accounts, and they make sure the sites that you are on are a real organization or person, right? So one thing that there are a lot of ones that, like, if you go to the World Health Organization and you look that up, there is going to be a similar fake account, right? So make sure it's like when you're clicking, you read the website name, right? The link out. This is something that I didn't have to deal with in college, right? Things we didn't really have. I didn't even have Facebook until like my last year of college, right? So this is something that is really new to us to have and having to deal with. So the fake information that's out there. And then who is the authority on the subject? So let's say you're looking into Black Lives Matter. Who would you believe on this topic? Like a white guy or a Black guy? If you're looking, if you're looking at like a doctor, where did they receive their education? Make sure you're validating your sources, okay? And so the next slide, please. So the next one is, don't get faked out. Okay, this is really easy to do. And again, like what I was saying is I never really had to worry about this when Google wasn't even really a thing yet. So I would go to the library and look up a book, and then you had to go through so many policies and hurdles to get a book published, right? Or article published. And so now it's a completely different story. When you do a Google search, it was easier to spot fake articles, and now they're really tech savvy, right? So one thing that I really like one resource is the American Library Association. This is a blog. This link, I'm not sure if someone could share the link for me or not. I can share them at the end, but so if this link is a blog with fake news resources to give you tips on check this site, and they're really great articles and blogs on how to spot the fakes. Also, one thing that I really like that I really did not know existed until I started working in libraries is fact checking sites. And the one that I like, although it does have a lot of ads, I mean, right, they have to pay their bills somehow, but is Snopes, and it helps show you legitimate articles, and they do the fact checking for you. So do whatever fact checking site that you like, go ahead and use it. And it just helps you find reputable sources. It's like you wouldn't use Us Weekly, right, to learn about something other than a celebrity, right? So you would go more towards like Newsweek or that sort of thing. So and I do like the World Health Organization, the Mythbusters link. I think that's a really good one to read as well. They've really kept up on what is going out around and out there right now. So the next slide, please. So this is top sources for COVID-19 information. So of course, right, we're here at the National Indian Health Board. There's that that website. I do like the Indian Health Board as well. I'm sure you all know possibly about that site already. The World Health Organization, although it is, I think that and the CDC, the Center for Disease Control, their websites just aren't, and I think this is something that public health has learned during the COVID pandemic, is that they need to create data that is user friendly, right? And I think here, the work that we're doing here at Hennepin County, it really wasn't for the public eyes, right? And it was just internal information, and now we are having to submit that, and it's just not easy to read in our terms and that sort of thing. So I think the World Health Organization and the Center for Disease Control is somewhat harder for general public. I feel like it's a little bit harder for me to decipher and read and understand. So the ones that the last two here that I have is the National Public Radio. You know, NPR is just something that's on when my mom's in the car or something, right? I never really thought about it, but they have been amazing. And so that link is, they call it, they have a newsletter that's really good. It's like the New Normal newsletter, I think it is. So that one is really great to sign up for. And I feel like it's readable and an easy read. And then the other one that actually has done a really great job over the past, well, gosh, I guess it's getting close to 2 years, right? Is the New York Times. So although they have always not been the easiest to read when it's in print, but online has been great. And I don't want to spend money on their website, right? But they do have a free newsletter. And so if you were to go to this link that I have here, you can sign up for their newsletter, and it comes in your email first thing in the morning. And it has been really easy for me to read and understand. So it's free, right? And so it has been really helpful for me to keep up on things that aren't necessarily happening near the cities, right? Across the board, like what is happening across the US, what is Europe doing, what is Germany doing? So those are the top sources that I have for COVID-19 information. And one thing a few things that I want to mention is when you are doing these searches and trying to find valid COVID-19 information, is look for peer-reviewed studies that are vetted. So, one thing that is really good to check too is the descriptive. So I probably will have a really hard time saying you know what I'm trying, oh my goodness, I knew I was going to have a problem saying this word, but they're just called the epi guys at the county, but they really suggest like looking for who, what, where, and the symptoms that are being summarized and track and reporting in the descriptive resources and the research that they have. And then they also, on the flip side, have the analytical um, sources, which are where the who is this happening to, and let's say there's 10,000 studies like this that have already been done. And then one thing they gave a example of is, let's say there are 10,000 mask wearing studies that have all proven that masks work, right? Wearing masks work. And then there's only 2 that can be found that they don't work. So you have to look at how many studies, and science really likes to be able to, it should be able to be proven over and over again, right? So if you see something that's only like 1 or 2 studies, and then you look at the flip side. So it's always also, I think we have to be skeptical, and then always say like, what is the opposite of this? So it's always good to know like what are the repeatable trends, and so those kind of, what do the results represent, right? It takes more time and effort to read something more than a headline. So it does take more time, unfortunately. Headlines are not your friend. So you need to find out, where is this data coming from? Who is reporting it? What is their narrative? And it is really easy to find articles that already fit our viewpoints. So it's really important to have an open mind. And when you are doing your research, research, especially with COVID, I would suggest that you stick to one question that you may have, right? So if you're worried about the vaccine, like, go and search one specific question, and don't get deterred by all these other articles or blogs or whatever it may be. So just stick to the one question that you're looking for. So one thing that we like to, as Native people, we have to see, are we in this case study? Like they're doing, this whole population, and then we need to look at the impacts that, and use an equity lens, right? Like, is this including Native folks? We all know Natives were heavily impacted by COVID, right? So what are the key impacts of this study? Did they include any Natives? Did they talk to any Native community members? So it is important to always look and see if we were included, right? So that is what I have so far, and I'm really wanted to take some time to see if anyone had any questions, or there was a couple questions that I had earlier, sent to me a little bit earlier. Let me bring them up because I did want to make sure that they were covered. So one thing that I would like to mention is, don't anything that plays off of your emotions, don't I would not pay any attention to it. Things that go off of fear, or anything dealing with your feelings on anything. So you need to stick to facts, right? So that's all very, very important. And then our library is a good place to get current COVID-19 information. That was one question given to me. So this is really hard for me to answer. I would love to say, yes, go to your library. I would love to say that. But It's hard. It's really hard, I think, because it has been a really political topic, right? And so, and libraries, for the large part, are run by the government. So, libraries, like just going off of what has happened here at my library system, we can post on hand washing, we can post on wearing a mask, information in that regard, but it is really hard for us to keep printing out and having on hand the information that, I mean, we're all surrounded by it, right? That the information changes daily. And so it has been harder for us to have information at our fingertips. So it I would say go there if you need to use computers and use that as a way to obtain information. But we really haven't been able to, like at my library, have like vaccine sites on hand, right? But we can help you look them up. They just continuously change, and some would have some that day or not or whatever. So it is a little bit harder, I feel like, with libraries, um, to get to have information posted, but we are definitely a good source to help you with finding resources. Um, Library staff are always a great resource, whatever the topic, COVID or not, right? And so, but we do have magazines, we have newspapers, and library staff to help with assist with research. And so where can you youth get current COVID-19 information? So um, if a library is not close by. So I would say I would really steer away from things like Facebook, or I would say your tribal clinic if you have one. And even if you are not, like I'm a nominee, right? And I follow my Menominee clinic back home, right? So I go onto their website, even though I'm not there. I do trust them, right? And so, and it's nice to see what is happening to my community back home. So if you are looking for information, and I would definitely go to your tribal clinic. One thing that I do like, too, I wanted to mention, and if you haven't heard of Illuminative, please check them out. They are amazing organizations. So they had a large part to do with changing the mascot of the Redskins, so of the NFL football team. I shouldn't even say it anymore, right? But so Illuminative is amazing. And what Illuminative started off with was Crystal Echohawk. She's Pawnee. She went around and did surveys on different communities, not native, non-natives, and said, "What do you know about natives? What and what have you learned?" And it's just a really amazing organization that has done the research, that has found out things. And they do, it's called Warrior Up, and so they have some really great information there on their website. I would encourage you to check them out. On They have, aside from COVID as well, like they have great information on lesson plans, and they have and one thing that I really like that Illuminative does as well is just keeps you, like, they would be a great one to follow on social media, because they really keep current topics and what they're working on. One thing that I went to one of their conferences, and one thing that really hit me is that they said with suicide, that natives, that youth that know their creation story are like 80 some percent less likely to attempt in suicide. So the research that they have is legitimate to our community, right? So I'm really a huge fan, if you can't tell, of Illuminative. And so I would suggest following them and checking out their site. And w- I know I only can speak from I'm here in Minnesota, and one thing that we have here is University of Minnesota Duluth. So it's still far away from me, but they have a really great site that their medical school has put together. And I know it is very Ojibwe centered here in Minnesota, but feel free to adapt this in however which way you would like. But this is a link that they did some really great visualizations and books and health books. And so and you can request them free too. There, if you go down on the website, you can click on them to order them. They're free to order, and they send them right to you. I've ordered countless ones of their health books to give away, and their activity books are great. But they also do have posters on how to wash your hands and how to be a good relative. And so I really like this site. And you can definitely adapt it to your location, or feel free to reach out to them too if you had questions. It's a really great group here. So that is what I had for my presentation today. Was there any questions? I didn't see any, but maybe if you want, go ahead and unmute. I'm not pretty informal here. Where's everybody from? Are you, I feel like is anyone Navajo here or Menominee? I'm really interested in seeing. And Joseph,
And feel free to raise your hand. If you don't want to type it in, if you're
yeah,
from Navajo, just raise your hand.
yeah, for sure. And Joseph, you're not, I hate to ask how old you are, but you're not who I know, right? Or do you? It's so hard to know, hard to see. But I know I have a friend. Yes, it is you. Okay. Your video is up. That's so not fair. Hi, it's so good to see you. Oh my goodness. Yes, tell your family hello too. Oh my goodness. How funny. We end up in the same Zoom. I will tell her hi. She's right downstairs. So does anybody have any questions or anything? I know it was I did that way faster than I practiced. So oh, thank you, Joseph. Joe, it's so good to see you, hear from you. But yeah, it is hard. I feel like it takes a little bit more time to assess things. And I feel bad because it's way harder than what I had to do in college, I feel like, unfortunately. These are just the times that we live in now. But yeah, so is there any other questions? Or oh, you're from
Allison, may I ask one question?
yeah.
So thank you so much for allowing the resources and the links and the tools that you shared throughout your presentation. I thoroughly enjoyed it. I just have like one quick question. In terms of like health literacy, being able to like, we know there's a lot of websites that have a lot of information. If there, when we're thinking about health literacy and the different types of populations that may be looking for this information, as a young person or as someone who may not understand a lot of medical terminology, can you provide like a little bit more understanding of where those type of COVID resources can be found that really breaks it down at like the population and the community level?
And it's hard, I think, as far as the American Indian community, because a lot of studies that were done, even in my own county here,
Mhm.
natives were not included, weren't even a thought. And that, that really is, and that's one thing that Illuminative states is they said that they state that the invisibility is the new racism, right? Just not even including us at all. And so what is it's so hard because you have to go to the bottom of the article, and then sometimes you have to look up like where is this, and then you have to go, it would be good to go and do a Google search on images, right? So that's always helpful too, to see a better graph, or sometimes they have more of like more data on like what communities were in it. So if you're looking at an article, it may just be one snapshot or something that's really general. You can go in and do a deeper search. So, and you can request, so like if you go to, this is where libraries are really great to use, is if you go like on our library website, you can go to like JSTOR. You can use your library card to get into valid resources, right? So JSTOR is a great one. And you can always look at, okay, so this article cites this article, where does this lead me? And so I don't know that I have an answer to
Okay.
your question specifically, just because a lot of studies don't have natives even included, right?
Okay.
But I feel like the Navajo Nation is really great. There are a lot of blogs out there that are supporting the Navajo Nation, just because unfortunately, we made the headlines, and we were one that it was shown, and it highlighted like where we really stood within the US. And I don't know, I went to go get my hair done one day. This is kind of a tangent, but like Aveda was saying like, oh, do you want to donate money to there was like something in Africa that they're without running water. And I'm like, hey, my grandpa has never had running water. Like, can we work on what's here first? I was just really, so I think that COVID has really brought to light what is happening. I'm preaching to the choir here, like you all know. But when you're looking at a study and you want to see if natives were included, you can go and Google that, and then images is always really helpful as well. So
Thank you. Thank you.
and then let's see
And
what.
and then do you see the comments in the box from Mr. Bird? Do you want to, or do you want me to read it?
No,
And
let me
also
see.
Joseph made some comments about the pharmacies.
Okay, the pharmacies. Oh, okay, great. Thank you. Thank you for that. Yeah, on their website, so CVS and Walgreens. That's great to know. From SD, hi. I went to high school in Albuquerque, and so it's nice to hear from you. Oh yeah, so following SD and their weekly COVID updates from okay, do you have a website, or is there a newsletter, or how are you getting those updates? The We Are Native website, is that I'll look and see if there is a link there, right? Yeah, and it does require internet, right? We need a phone to get, so that's another way that a library is really helpful if you need to go there for internet access. Even here in the Twin Cities, you had to come into the library to use our internet, right? And you had to use the login and you had to do this. And there was so many hurdles even to use our Wi-Fi. And that was one thing that we learned over the course of COVID. We were closed. How are people using our Wi-Fi when we're closed? You can't even come in the doors. And there was a huge push to lengthen our Wi-Fi. But that was a really hard step for us to do. We had to be analyzed and this and that. And it was a huge upgrade. And so we had to pick and choose a few libraries and for even people to sit in our parking lot and use our Wi-Fi. It was, so that was really hard. So in addition to the IHS platform COVID-19 information, other medical-based websites, WebMD provide patient-oriented information. Great, thank you. I never knew about, like, WebMD always get lost, and then I'm like, oh my God, it's just a headache. No, it's not. So I always am scared about WebMD, but that's good to know, Joseph. Thank you for sharing that. Oh, they partnered with Illuminative for the love of our people. Oh, that's so good to know. I didn't even know that. So again, it's proven Illuminative is wonderful. So so check out that for other tools and resources as well. Great, thank you for sharing that. I totally adore them, and I'm glad I hope they are able to stick around for time to come. Is
And
there
thank
any
you,
other?
Allison, for joining us today and really engaging with our audience. Thank you so much. That was really helpful. And I am just going to include Allison's email in the chat box. If you have any additional questions or about the different types of websites, about which ones are good, which ones are bad, or you want to like shoot her an example of maybe some information that you have seen and just want to get her professional opinion, is this something that we should be pushing out to our community, please do so. She is a subject matter expert. This is where she shines bright. This is where we can rely on her 1,000%, and she's a rock star. So definitely, please do not hesitate to reach out and utilize Allison as that resource. And if you have any additional questions and you cannot get in contact with Allison, please do not hesitate to email Darby Gallagher at DGALLIGHER@NIHB.org for any additional questions. And Courtney, just put that email in the chat box also. So at this moment, I would like for everyone to use your reactions if you are on the desktop, and that shows some love to Allison for joining us and show our appreciation. Let's give some hearts. Let's give some claps. Just make her feel, oh, thank you, thank you, thank you. And so with that, I hope you all enjoy the rest of the Youth Summit. We have another session that will start at 2 p.m. or in 15 minutes. So please take this time to get up, to stretch, to use the restroom, to get a light snack, and I will see you again in 15 minutes. Again, thank you all so much for really interacting with Allison and just making this an excellent session. Thank you.
Bye, take care, everyone. Great to see you too. Take care of yourself.